When a North Jersey hospital looked for ways to serve a Jehovah's Witness community whose religious beliefs don't allow it to accept blood, it turned to pioneering what was then an emerging practice, bloodless surgery. Now, that was 15 years ago. Today, bloodless surgery is the norm at Englewood Hospital and Medical Center, where of 15,000 procedures a year, fully 95% are bloodless. NJN News health and medical correspondent Sarah Lee Kessler has the story.
We'll use a cell saver now.
When it comes to bloodless medicine, Englewood Hospital is considered a world leader. For years, its bloodless approach has been used for everything from gastric procedures to cardiac bypass surgery. Proponents say going bloodless promotes healing, reduces infection, and saves lives.
The results that we have, which is the lowest morbidity and mortality in cardiac surgery in the state, is associated again with the lowest transfusions rates that have been published so far.
The lowest transfusion rates, not just in New Jersey, but nationally and internationally. Dr. Aryeh Shander is founder and executive medical director of Englewood's Bloodless Medicine program.
We've had patients come from 42 states in the United States to get care at Englewood Hospital Medical Center, and we've had patients coming from 45 nations outside the United States to get care here too.
Some, like Jehovah's Witness patients, choose the bloodless approach offered here for religious reasons.
Throughout the Bible, God tells us not to take blood, so I follow that.
In the operating room, instead of blood being transfused, it's collected and recycled. The blood that is lost during surgery at hospitals like Englewood is suctioned out by a cell saver machine, and then it's cleaned and returned to the patient's body.
And so the patient really becomes their own blood bank.
Sherry Ozawa is the director of Englewood's Bloodless Medicine program.
Medical literature shows that about 60% of the time, patients receive blood for no good reason.
Transfused blood, according to Ozawa, can lead to serious complications.
Increased risk of death, increased heart attacks, increased strokes, increased ICU stay. And that really doesn't matter if it's your own blood or someone else's. That blood is not the same. Once it comes back out of that fridge, it's not the same as it was when it went in. It does not pick up oxygen very well. It does not drop off oxygen very well.
People who care about this issue should make sure to carry a no blood card. Sarah Lee Kessler, NJN News, Englewood.